we're already talking about this.
Because we are both parents of middle school students.
But here to share more, Dr. Scott Hadland, Chief of Adolescent Medicine at Mass General Brigham for Children. Thanks as always for joining us.
Also a parent,
yes.
So you know this age group very well and the cell phone issue very well. I mean, we all kind of had the privilege of growing up before this era, largely. Do you think these bell bans make sense?
Yeah, I think they do make sense. And it's not just me. National surveys of teenagers actually show that about 75% of adolescents actually support some level of restriction on cell phones in schools. About 90% of parents support them. Most teachers say that cell phones are disruptive in the classroom. So I think, some level of restriction is really important. These bell-to-bell bans, I think, are a little bit more severe. And I think, support for these drop down a little bit. But in general, I'm supportive. We know that when teens use cell phones throughout the day and for many hours on end, they're more likely to have symptoms of depression, anxiety, have difficulty sleeping at night, poor academic performance, poor relationships with their peers, and be at risk for obesity. So there's a lot on the line here.
They're distracted.
Yes, so much, for sure. And then they can't put them down. We know what that's like. So you've read so many studies about teens and cell phone use. Is there an amount that's safe, and what is too much?
Yeah, if we're being fair to the data, the studies show that really once you get up to about 4 hours of usage per day in a teenager or beyond 4 hours, that's when you really start to see a lot of these harms that I just mentioned. Now, 4 hours a day is a pretty high cutoff, and I certainly would not recommend that. And so when I'm talking to families, I really recommend what the American Academy of Pediatrics says, which is that about an hour or two of entertainment screen time for teenagers is probably the right amount. That some level of screen time is okay and safe. I think it's also important to remember that it's not just the quantity, but it's the quality, right? I think teens do better when cell phones are not in their bedroom at night, are not at the dinner table, are not next to them when they're doing homework. So thinking about when and where the cell phone is being used is also important.
So you mentioned some poll numbers that about 3/4 of kids think there should be some restriction. There are, though, going to be some kids who think bans are a bad idea. What do you want them to know?
Yeah, well, to be fair, there's a lot of hypocrisy here, right? We're adults talking about how we should ban cell phones, and yet so many of us, me included, don't have our own cell phone use under control, right? So I understand when teens kind of roll their eyes a little bit at us. At the same time, the patients that I care for who have intentionally cut back on their screen time and tried to put their cell phone away during key times have told me that they feel better, that they have better well-being, their mental health is better, they're sleeping better at night. So I think that there's a very good chance that with these bans, we'll actually see some improvements in some of these outcomes we've been talking about.
Okay, Dr. Scott Hadland, as always, thank you.
Have a good weekend.